welcome back to the channel. My name's Sarah Louise and today I'm going to be talking about what you should take to the hospital if you're going in for spinal fusion. So if you're new to the channel, I had my spinal fusion 9 years ago now, and this series is talking about all things scoliosis, spinal fusion, so make sure to subscribe and check out my other videos. So the first one, which was really important to me that I didn't actually take, was a fan. So wherever you are in the world, you don't know what the weather's going to be like, and the hospital might get really warm, so a fan is a really good thing to take. Number 2, so this should be something really easy to get on and off after your surgery. So normally you'll be in a gown or something when you wake up, but sometimes they're quite uncomfy, so you may want something that's yours. So I took a nightie that just went over my head, but I actually cut down the back so that it was really wide to be able to get over my head, because sometimes you might have you know, like tubes and stuff coming out from your neck, so you need something that's really loose, able to get on. Number 3 is some footwear which are also really easy to get on, so maybe slippers that you can slide into, maybe got some grips on the bottom, so you will need footwear when you're getting up and about walking in the hospital. You'll probably be doing this quite fast, maybe within the first day, so definitely have those to hand, otherwise you might not have anything on your feet. Number 4 is food or snacks. So obviously when you're in hospital you'll probably get the meals that are supplied by the hospital, but sometimes you might not like them or you want something a bit different, so crackers, things that are just really easy to just take a bite out of, or are just really easy and good to have on hand for you or for your parents who may be peckish as well. Number 5 is something to do. So you might be in hospital for a lengthy stay. So I was in hospital for about 2 weeks, and so it's really important that I actually had things to do, things to look at. So I took a lot of magazines, but you can take books or a tablet or just your phone, but make sure you have something to do, because the days are really long, especially when you're in pain. You just need something to distract yourself sometimes. Number 6. So this is a chapstick or something that you can put on your lips, really easy. They might dry out during surgery, so just an easy one to have in your bag. Number 7 is moisturizer. So you may or may not need this depending on how your skin is, but you probably won't be washing your face really while you're in hospital, so it might be good to just have some moisturizer to hand if you need it. Number 8 seems really obvious, but a hairbrush. So you might be in hospital for a long time, and you don't want your hair to be really matted by the time you get out, so hairbrush is just a really easy one. Number 9 is your phone charger, your tablet charger. Maybe get one with like a really long lead, as you don't know where the plugs are in relation to your hospital bed. Number 10 is lozenges or something that you can just suck on. Number 11 is headphones. So depending on what you like to do, you might want to listen to music or listen to some podcasts. That might be a really good way of passing time. Also in some hospitals they have like these TVs that you can kind of bring over your bed. I know I had one when I was in hospital, and that was just nice if you could just have some headphones to plug into that. Number 12, so this is really down to you, but you might want to take them. So that is earplugs. So depending on what ward you're on, you might be on a child ward or an adult ward, and you'll probably have beds next to you if you're in a ward that are occupied, and these people are obviously in pain just like yourselves, and sometimes it can be really noisy, especially if you're just trying to get some sleep, as sleep is just the best way to just sleep the pain away. Number 13 is much like the earplugs, so an eye mask. I was in the wards, and even on the night time it was still quite light in the wards, as the nurses needed to, do their jobs. So an eye mask would be good if you like to have it dark when you sleep. Number 14 is the final one, and that is a face cloth. So that might be to actually wash your face after surgery or like in the morning, but it might also be used for if it is really hot in hospital. You can run it onto cold water and put it on your head, and that can just cool you down. So that concludes my 14 things to take to hospital when you are going in for spinal fusion. Make sure to drop me a like if you found this useful, and subscribe, or just check out some of my other videos. I've talked about the positives and the negatives of spinal fusion, and I'm going to continue with this series and talk all about scoliosis and spinal fusion.